game begins by showing the patient's condition to allow nurses to know the admission details. After knowing the patient's details, the player presses the Start button to begin caring for the patient. The Action button shows all the available interventions that can be rendered to the patient when needed. It is of a selection process. Once the player clicks certain interventions, the stats on the left would show the reading or the results in response to patient's presentation. After providing the interventions for the scenario, the player have to press Submit in order to see the results of interventions provided. The game would then reward stars for the correct interventions or show deterioration level for the wrong answers. The patient is complaining of chest pain.
Nurse, my chest very pain.
ECG is then obtained as an option selected by the player, where the player gets to place the correct leads accordingly. This is a 12-lead ECG rhythm, and the player is required to interpret the ECG. When the player chooses to report to the doctor, they are required to use the communication tool called SBAR. This is to allow the player to be familiar and educate on the use of the tool even in the clinical setting. This is a sample of how this game is played.